You are listening to Community Heroes Table Talk, where we talk with people and share their stories about their disability. And now for your host, Tyrone Starkey. Welcome back to Community Heroes Table Talk. In today's episode, I have the privilege to talk with Mallory LaTouche about how the human body affects with disability. How are you doing today?
I'm doing good. How are you?
I'm doing good. Can you talk about what autism is?
Autism is a behavioral disorder caused by abnormality in developmental processes early in life.
How do you manage autism?
Autism is a lifelong condition, and once diagnosed, the child will need to be educated in a suitable setting with multidisciplinary team.
How do you cope with autism?
Behavioral interventions are often used to help promote adaptive behaviors and reduce behavioral issues. Medications are used in some instances, but only to a limited degree.
What is ADHD?
ADHD, or attention deficit hyperactive disorder, is a neurodevelopmental disorder characterized by inattention or excessive activity and impulsivity. Excuse me. I myself have ADHD. I was diagnosed with it about in middle school, and ever since middle school, whenever I was diagnosed with the disorder, I really know, excuse me, I really didn't know what it was or how it was going to affect my life. But till this day, and I've been told that everybody's like, "Mel, you don't seem like you have a disorder." And like, you've said before, you don't let your disorder define who you are. Until this day, I never have. And there's days where it doesn't even seem like I have one until it comes to being in a classroom or the way I teach or the way I've been taught. And I've used what I've been taught in the past, and I've used that technique to teaching, my tutoring students, and I bring that to the table so they know that I have something in common with how they're learning.
What are some day-to-day symptoms that you would go through with ADHD?
ADHD, where you're excessively moving your hands or you're pacing or any kind of body movement where you're moving really rapidly and really quickly, where even, for example, the way I'm talking, it seems like I'm talking fast. But this is the way I talk on a daily basis. And it just seems like, because it's just the way my brain is running, it's constantly, you know, it's constantly running where there's always something going through my head. Regardless of what it is, there's always something going through my head.
With ADHD, do you see more people talking with their hands?
Actually, not really lately. I do see them use it just as a regular hand gesture, but I don't really, well, I really haven't come in contact with anybody that shares the same mental disorder that I do, or not that I'm aware of. But it's also one of those, I constantly use hand gestures on the way I explain things, or just, getting my point across. It, I always enjoy using my hands to explain things.
What is Down syndrome?
Down syndrome is a genetic abnormality caused by the presence of an extra chromosome.
What are the causes of Down syndrome?
The failure of chromosomes to separate properly during meiotic cell division is termed meiotic non-disjunction. This can occur during the formation of germ cells, the precursors for sperm and ova in either parent, and can lead to an unequal number of chromosomes in the daughter cells.
What is epilepsy?
Epilepsy is a group of neurological disorders characterized by recurrent epileptic seizures.
What are the two types of seizures when it comes to epilepsy?
The two types of seizures are generalized seizures, which is primary epilepsy, where it deals with the whole brain, and then you have partial seizures, which is secondary epilepsy, and it only deals with the brain partially.
Can you talk about what you have to go through, like enabled, like for working and even school? Like if you have epilepsy, like do you have to inform your teachers or your boss, like, hey, I have epilepsy, so like if I fall on the floor, just know that I'm not fainting or something like that.
I would bring it to their attention just so they have the proper the medical assistance needed at that time, and just to let them so that they were aware and the way it needs to be handled and there's proper precautions for it.
What is Alzheimer's disease?
Alzheimer's is a chronic neurodegenerative disease that usually starts slowly and gradually worsens over time.
How does it affect your brain?
There is no single diagnostic test for Alzheimer's, and the diagnosis usually is made by eliminating other potential causes of dementia. So pretty much when you're diagnosed with it, it just deteriorates throughout your whole life. Your memory, things you remember in the past, you may not remember anymore. Just your memory is going to slowly deteriorate throughout the rest of your life.
What is cerebral palsy?
Cerebral palsy is a group of permanent movement disorders that appear in the early childhood stages.
Can you talk about like what kind of effects cerebral palsy has? Like, for example, I have a mild case. So can you talk more about what a mild case is versus a severe case?
Cerebral palsy may be diagnosed at birth, but it's frequently delayed, particularly in mildly affected patients such as yourself. In these cases, cerebral palsy generally is recognized during the second year of life due to abnormalities in the child's gait, which is the way their posture is, the way they're walking.
What are the treatments that you can do for cerebral palsy?
Physiotherapy helps normal motor development and prevents contractures. Visual impairment, squints, deafness, and orthopedic deformities are treated by specialists in each particular field.
Can you talk about, for example, whenever I was born, I had a AFO, and how does that affect the human body? Like, for example, I couldn't walk straight, so can you talk more about that?
Unfortunately, Brandon, due to the fact that I don't have that medical expertise, that I would actually refer you to a doctor that specializes with patients that had cerebral palsy.
Thank you again, Mallory LaTouche, for your table talk segment on talking about human body and how it affects with disabilities.
Thank you, Brandon. I certainly enjoyed it.
You're welcome. You can find Table Talk on Facebook, Instagram, Twitter, and on our YouTube channel at Community Heroes. You can search up Community Heroes Table Talk to find all of our recent Table Talks interviews. Thank you again, and have a great day, and see you in the next episode. You are watching Community Heroes. Please feel free to like, share, and subscribe to Community Heroes on social media and on YouTube.